what is the client's name and date of birth, the location that the call is occurring from, what language they prefer to speak in, if they can speak safely and openly, and then kind of starts with some of my concerns that I'm bringing to the table, and then go down the list of medical student 1 and 2, dentistry and pharmacy.
Sure.
How does that sound to everybody? I just kind of jotted things down
That sounds
from
good to me.
orientation, and it kind of made sense in my head, so I wanted to bring it with me today.
Okay. Yeah,
Sounds
that's
good.
fine. Yeah. So whoever wants to put in their concerns, I guess I'll be the 5th person to speak. And I can just write in, I was thinking about tackling diabetes, or obesity. If anyone was thinking to do the same thing, let me know and I can change mine up.
I just put in concern 1.
Okay.
But that's fine. I think diabetes is good for you to tackle.
Okay. Alrighty. And I thought I would do like, I don't know if you guys just want me to copy it or like actually talk through it. I don't know how you guys want to do it.
Maybe just copy and paste what you thought you'd do, and then we could talk through it after everyone has done that, so that we could all be on the same page. And while she's typing that, everyone feel free to type in your other concerns as well. And we could always switch up the orders of concerns if we decide we don't agree about them. So I hope everyone has access.
Quick question, because for the COVID concern, the patient doesn't have COVID right now, right?
I thought they were diagnosed with COVID.
They were diagnosed in the beginning of January.
Oh, so they don't have COVID now. Okay, I probably misread that, so let me change that. So then can you, or maybe I'll just reopen up the case if possible. So they don't have COVID now, but they're still feeling shortness of breath from having it in January?
Yes, I think it's more of a like an anxious feeling too, no? Or like that's caused them from like it's increased their health problems, and I think it also has to do with like them not wanting to go out because of that or something like that.
Okay, that makes more sense.
Yeah.
And Lily, feel free to edit what I pasted too then, because this is completely off now.
Yeah, I don't know. I just didn't really see, like, I mean, I feel like with this patient, like, I didn't really see them having like any chronic symptoms of COVID.
Okay, I
seemed
thought
like
they had shortness of breath then. Maybe I'm reading something else.
Okay, just like make sure everyone's on the same page. Everyone's looking
Yeah.
at Courtney Grimes, right?
Correct.
hmm
Yep, Courtney Grimes.
Okay.
Imagine we were all looking at different ones. Okay.
Lily, where are you finding the case for Courtney?
It was under like the pre-visit requirements.
Okay. I'm just making sure I'm looking at the right one, because I didn't think I saw
They didn't post it until like Saturday, I think, or Friday night. So it took them a while to, post it on the Canvas page.
Okay, then that makes sense. Okay.
Yeah.
So we should discuss her hypertension.
Yeah.
Okay, and obesity. I just never got the notification of the new case. That's why I'm
Me
so
either.
sorry.
No, you're okay. Me either. I had to go in and dig for it, and I had to ask a couple of people who did it on Saturday because I'm like, I don't see it. So no, you're fine.
Okay, so Lillian, you're doing diabetes and obesity, right? For
Yeah, I could do. I mean, if someone else wants to do obesity, they could. But if you guys want, I was just gonna tackle them both because what I'm using is gonna decrease. It's gonna do for weight loss. Yeah, so I can do that. Yeah.
Okay.
I could also do the knee pain. We could talk about that.
Yeah. So I feel like for medical, like one of us could do like hypertension and hyperlipidemia, and then the other could do the knee pain.
Yeah, can you do the hyperlipidemia because I don't think I have time to prepare for that, and I'll work on the other one. So let me just delete this.
For that, I was really just gonna say that like they're not taking max doses of either their hypertension medicine or the statin. So
Yeah.
I think we can just increase those.
Okay. I'll put the knee pain under concern 3, I guess. And then Lillian, I guess after I talk about knee pain, you could jump in with obesity, and then that way it'll be like a transition.
Yeah, that's fine. For obesity, so it was gonna kind of. So if we do that, then maybe it should be better to do obesity and diabetes at the same time because we're gonna say like because I'm using kind of the medication too to help with that besides like the non-farm like
Oh,
walking.
okay. Yeah, I
You know
see.
what I mean? So is that fine with you
Yeah.
guys?
Yeah, of course.
Okay. If anyone else, please speak now and let us know.
I think like too, you can kind of tackle some of these things from various angles. As far as medical stuff is concerned, like I don't, do a whole lot of that. However, for instance, the issue of obesity, something that I might talk to her about, and this would tie in with her lack of enjoying activities and not getting out quite so much, but also address the weight and also address the stress between her and her husband is like taking walks together as a means of stress relief, but that also
Mm-hmm.
kind of ties into the obesity issue, or talk about possibly connecting her with some facilities in the area that hold fitness classes for people her age, like a YMCA situation often works on scholarship. So a lot of times people can go there for free and then have access to like fitness classes or other social classes for no cost. So that might be something that I bring up in addition to her food insecurities, which would, of course, tie into maybe her weight issue or her sugar issue, but I might take it from an angle of maybe connecting her with SNAP benefits or something along those lines.
Yeah, I
That
mean,
sounds good. I think we could always just jump in
yeah.
and add on to each person's part as well. So because you don't want to go back and forth on issues, like we don't want to talk about like weight like 4 different times during this
Yeah,
session. You know what I
So I
mean?
think when it's brought up, I think whoever has something to say, just jump in and go ahead and say it. I think that would be good.
Yeah, and like
So,
also the patient is going to kind of lead the conversation too based on their concerns
Right.
as well. So it might not flow as how we want it to flow.
Yeah.
something that like I work on is like a facilitating meeting. So basically helping to guide things so that we don't maybe stay on the issue of weight for too long, or that we don't stay on the issue of sugar for too long, or other things. So if everybody agrees, I could help to facilitate things in that way, and maybe go down the list of concerns and then take turns one by one discussing our individual contributions to that topic.
Yeah, sounds good.
Try to stay out of your guys' way in terms of, like diabetes, everything else, and just address the dental needs and how they kind of tie into your guys' topics. But I won't say anything about like hypertension and all that.
That's fine. Okay, I just had a quick question for you guys. So I gave 2 options. Would you guys think it's best to like ask if she's willing to use injection versus oral? Because oral, it's not as efficacious as the injection one, from what I've been reading up on. So would you guys want to do the option of giving oral or injection, or would you guys should like want to just be like, okay, no, we're gonna do injection? Like it's the same medication, it's just the site of administration is different. So what do you guys think about
I
that?
think ask the patient's preference because I know some patients might not want to
Yeah, yeah.
do injections.
Okay. All right, we'll do
Does
that.
one work better over the other?
So, for the injection, the only thing that stops patients is the fact that it's an injection. For the oral, for that whole month that they have to take the first dose, it's not efficacious, if any, at all.
Okay.
So that's why, like, you would have to kind of start them on the lowest dose, and then you have to wait a month to titrate them up for it to start working. So, like, the patient has to wait like a whole month for it to kind of start working, but still not really working for the oral, if that makes sense.
Okay, yeah.
Yeah, so I mean, it's just gonna be a little bit more time if she goes the oral route. But I mean, if she would prefer that over injection, I'd rather have her have something than completely be opposed to having an injection, you know what I mean?
Hmm.
Okay, we have a little chart. I think we
I just added the
oh,
chart because I know we have to submit an agenda and the chart,
yeah.
but this chart is supposed to be, I think, done second. So I'm just gonna start working on it.
Okay. I think we have to do the concerns from number 1 to like the least concern. So,
Yeah, but I think it's based on the patient's concerns, right? Or is this us here?
let me see, identify 3 to 5 and recommendation the team has for the patient. Your concerns should be prioritized from number
Okay.
1 to number 5.
So what do we think is the most concerning? Would that
I think,
do you want to say the hypertension and
yeah, I think I
hyperlipidemia?
would leave the hypertension, hyperlipidemia would be number 1. I think I would make diabetes as number 2, because they kind of all tie in together. No? Like, I feel like
Yes, I agree.
once you have one, you have all 3 eventually.
And then would we say the second concern would be dental.
Yeah, I would possibly consider that because I mean her tooth is already loose and she has periodontitis,
Yeah.
which is just like a vicious cycle along with her like blood A1 or HbA1c levels. So getting that under control, it would either be the tooth being loose and the jaw pain, or the periodontitis.
Okay. I'm just gonna write that. No, it's not working. Okay, whatever. Slash okay. And then next, do we want to discuss knee pain, or do you think knee pain kind of goes in with the weight?
I feel like that could go in with the weight, but also I don't know. I'm not sure.
I think when
You
you
could
address
put.
the weight, you can kind of tackle some of those other surrounding issues right with it. So like the weight itself could be an important concern that we bring up.
Okay. And then our last concern, or do we not have, or what's our fifth concern?
So a concern I definitely want to bring in is just how she's doing socially and emotionally, because she's showing some signs of depression and lack of interest in activities with a lot of stress in her home. And it looks like she's also has some really negative repeating patterns as far as her health, because her health is kind of following that of her parents, and her husband is struggling as well. And I think that stress is kind of an important point to talk about to be able to control some of those other issues.
Okay.
Yeah, we can definitely tackle that as like I think that would be great for you to wrap it up too, because you're starting us off like you're introducing, right? So I think ending off with that and just kind of wrapping it up, I think that would make it flow very well. So then do you guys want to address them in that order? Kind of, but like also not really, but like you know what I mean?
Mm-hmm.
So we can address it in like the concern, like our major concerns orders. Like we can start with the hypertension, dyslipidemia, and then we can do the diabetes, the teeth, but we can also like talk about obesity and knee pain with the diabetes.
Sounds good.
Yeah, I think
Sounds good.
okay.
Yep, that sounds good.
Perfect. And then we have a care plan to do after, but that one, what we could do if you guys want is just kind of whoever took on that concern, we can just share, like we can share a doc and then just work on it separately. Whoever has whatever concern, and then I can just submit it once everyone's done.
Excuse me.
Sounds good. We could even work on it in this
Yes.
doc,
Hello?
and
Yes.
then
I-
hello.
Hi.
Excuse me for interrupting, but you have 5 minutes before you get to 10:30, 11 o'clock, and you only have 30 minutes for the entire encounter. So you might want to wrap up your consultation.
Sounds good. Thank you.
Call me when you're ready. Just say you're ready.
Thank you.
Okay.
So is everybody okay
Um,
if I lead off with the introduction and then kind of facilitate each bullet point, and then everybody can one by one jump in with their concerns about it, and I'll just try to keep things on track time-wise in that regard?
Sounds perfect.
Yep, that sounds
Cool.
great.
Is
So
everyone ready?
I was gonna say, yeah, as far as my
Think so.
concern, I'm all set.
I feel
Okay,
comfortable and
let's start.
confident.
Perfect.
Hello.
All
How
right,
y'all
Danny.
doing?
Hi, Danny, you want to start us off?
Good morning. Who all do we have here? Uh-oh, I've got some things popping up that shouldn't be. One moment, guys. I apologize. I'm having a technology issue.
I think we could continue with just introducing ourselves then first. My name is Sahar Almanini, and I am a third-year medical student.
Okay, guys, I'm back up and running. So I just want to say good morning. First of all, guys, sorry for the little glitch here, but I'm Deanna Hawley and I'm the social work student. I'm in my third year at Wayne State University and my pronouns are she, her. And thank you all for participating in this project and Courtney for your volunteering to help us out here. Can I ask your name and date of birth?
Yes, ma'am. I'm Courtney Grimes. I was born on January the 1st in 1960.
All right. And what is the location that this call is occurring from today?
Well, I'm in the city of Roseville, Michigan.
You're in the city of Roseville, Michigan.
Yes.
And what language do you prefer to communicate in?
I would like to use English, please.
English? All right. And are you in an area where you feel that you can speak safely and openly with us?
I am.
All right. Well, thank you again for participating in our meeting here today. How are you doing?
Well, I've had better days.
You've had better days? What's going on?
Well, I'm hoping everything was fine because I came to the clinic 2 months ago and nobody ever called me or addressed any of the lab work that was done or stated anything that I needed to do extra other than the stuff that I'm already doing for the chronic conditions that I have.
Okay, I'm sorry. That's really frustrating, Courtney. Um, so just real quick, I want to mention that today I'm, I'm here as a social work student, but we also have two medical students with us, a dentistry student and a pharmacy student, and we're just kind of had an opportunity to review your history and some of your medical information. And we're all here today to see if we can help to enhance your quality of life a little bit and discuss some of those concerns with you. How does that sound?
That sounds good.
All right. So we all discussed as a team some of the medical concerns and some of the other things that you have going on today. So if it's okay with you, we'll go ahead and discuss some of the issues that we wanted to bring to the table. So it looks like you have some issues with some hypertension and some hyperlipidemia.
Um, I'm not familiar with hyperlipidemia, but yes, I do have high blood pressure. And well, shoot, I've had high blood pressure for 12 years.
So I want to go ahead and invite some of our other participants in here to discuss those issues with you.
Okay.
All right, yeah, hi, Courtney. My name's Lily. I use she, her pronouns, and I am a second-year medical student at Wayne State. And I'd like to talk to you about the hypertension and hyperlipidemia, and I can kind of explain what the hyperlipidemia is, if that sounds good with you.
Yes, ma'am.
Okay, so just starting with the hypertension, it's looking, I have here that you've been taking your blood pressure at home.
Yes, I do.
And that the blood pressure reading averages around like 140s over 88.
That is correct.
Okay. And so to me that seems a little high still. And so I'd like to kind of work to get that down a little bit. And it looks like right now you're taking amlodipine, benazepril. 5 milligrams and 20 milligrams by mouth daily. Does that sound correct?
Yes, I take the amlodipine once a day, and then I take the what is the other one that I take for the high blood pressure? Which one did you say?
The benazepril.
Oh, yeah, that's got a name other than benazepril, doesn't it?
Let me see.
I thought amlodipine and benazepril was the same thing.
So that pill is a combination pill. So amlodipine and the benazepril are both in the pill. It's 2 different medications, but combined in 1 pill.
Okay, well, yes, ma'am, I am taking that.
Okay. And do you feel good on that medication? Do you notice ever any side effects with that?
Well, I have a regimen of medicines that I'm taking, so I really couldn't state which one is causing me to have comfort or discomfort.
Okay. Are there any symptoms that you're having, like at all, that you might think are related to any of your medications?
Not really, but shoot, about 10 days ago, right at the end of February, about February 24th, I think it was on a Friday, I fell.
Mm-hmm.
And I hit my chin, and I ran, when I was able to get up, I went to an urgent care because I had some concerns.
Mm-hmm.
And they did some x-rays and examined my head, and they sent me home.
Okay.
Courtney, did they mention any of those concerns to you while you were there, or did they state that they were going to follow up with you?
They said if I had any concerns to come back. They didn't say
Okay.
that they was going to do a follow-up, but I will say this, since I had the fall, the tooth pain is greater. And I'm now using, more medicine for the toothache than I've been using.
So Courtney, at this time, why don't we go ahead and discuss some of that tooth pain? We have a dental student with us today who can kind of help us out in that area.
Okay, that's fine with me, especially if she can come up with a way to fix the pain that I'm having, and I also feel like my tooth is going to come out. I think it's chipped.
Hi there, Courtney. My name is Ramin Ragazar. I go by he, him pronouns. I'd like to discuss, the issues you're having in regards to your dental pain. So you said you have, your jaw is sore, you have tooth
Yeah,
pain.
my lower left jaw.
Right. And was that present there before the fall or after the fall? Did it become worse?
I would suggest that it's worse now,
Worse
because it
now.
was always present.
Right.
And I'm now dealing with the sensitivity to, if it's too cold, it hurts. If I
Mm-hmm.
drink something or eat something that's too hot, it hurts.
Right. And that's as a result of the fall, like the sensitivity. I
But
would
I've also, I'm sorry to interrupt,
go ahead,
but
go ahead.
I don't floss because
Right.
that's painful, and then sometimes my gums bleed.
Mm-hmm. Mm-hmm. Ideally, this would we'd address the gum issue first. Flossing is a very important part of your oral health. If you don't floss, your oral health can worsen. Bacteria accumulates, like in the surfaces in between your teeth sometimes. And eventually, this can lead to something called periodontitis, where your gums are inflamed. That in itself can cause some pain, dull pain constantly. Sometimes it can go undetected. It's very important to get that under control before we address any other types of tooth pain you have at the moment. Because it's hard for the area to heal if we don't have the gums under control. But have you ever been instructed on how to brush your teeth, flossing, just taking care of your oral health in general?
Well, I'm 63 years old. I think I know how to brush my teeth.
Of course, of course. Sometimes even I make small mistakes or forget myself. But would you like to maybe go over it again once more, or do you think that would be helpful for you?
Yeah, if it's gonna get me a dental place I could go to and have the concerns really addressed, because at this stage of the game, I haven't been to the dentist in some years now, and that's because I can't afford it. And the insurance that I have never suggested that it was going to be covered. Every time I went in, they was uh, stating that I got to pay for this, rather it be an extraction, because it was suggested I have my tooth extracted a while ago, and I haven't been able to do that yet.
I see. I see. Um,
Especially since my blood pressure was high.
right, right. I would, maybe with all the tooth pain and stuff going on, I'd recommend we probably at least try to get into a dentist's office. Maybe not go through with the extractions if money's a concern at the moment. Um, Resolving the periodontitis and periodontal issues to get your gums into a healthy state, and then I would recommend we do testing on the tooth that has sensitivity, like pulpal testing, periodontal testing, to really see what's causing the issue of your pain. Um, Perhaps that tooth in general, that from the fall that was loose, we could address without any sort of crazy extraction, something like that. But as for the other teeth, if they've been recommended to be extracted for a while, um, we might have to tackle that in a bit.
Okay.
If I may interject, I have a thought for you, Courtney. You're mentioning that money is kind of a barrier in accessing dental care. Has anybody ever talked to you, like through a Department of Human Services office, about getting in touch with like a community dental center that works with low income people? And
No,
if you might
ma'am.
qualify for that? So I
No.
think that's a recommendation that I'd like to make, is if we could maybe go through that application process and look at getting connected with like community dentistry, because they may be able to tackle a lot of those issues for you.
Okay, I would like to try that.
All right. So Courtney, we just had a couple of other health concerns we wanted to bring up to you. I understand that you have diabetes. Is that correct?
I've had it for the last 10 years.
You've had it for 10 years, and it looks like you've had some lab work done and have some maybe some high blood sugar issues and those kinds of things going on.
Yeah, I have the high blood, you say the high blood pressure issues?
Blood sugar?
Oh, well, again, I was there 2 months ago and I didn't get nothing was addressed. I was there, and this is, my follow-up scheduled visit. So I'm hoping you could tell me what's going on with me, because no one has.
Okay, and our medical students are here and very knowledgeable in the area, and I think they have some really great ideas for you.
Okay.
Yeah, hi Courtney. My name is Lillian. I'm gonna be kind of talking to you. I am a pharmacy student at Wayne State, and if you're okay with it, we can kind of just address your diabetes. I know you're very frustrated. I can see that no one has talked to you about it, and I believe that, that could be such a frustrating thing. So if it's okay with you to move on, I can kind of go ahead and address your diabetes situation, and we can hopefully get you at a good therapy for you today.
Okay.
Okay, so I'm looking at your labs. The last time you were visited, it looked like your A1C was 7.8, and what that means is basically your blood sugar accumulating for over 3 months. And that is a little bit high. So we do want to definitely bring that down. What I could do for you is I could speak with your physician about a regimen called semaglutide or Ozempic. Now it comes in two forms. It comes into by mouth and it comes into injection. Now, how comfortable are you with injecting?
Not comfortable. I'm already taking medication for my diabetes. So are you suggesting I add to that or
Yes.
subtract?
Yes, nope. So it would be, I would be keeping you on your current regimen, your metformin 1000 milligrams. You're taking that twice a day. So what I could do is if you don't want an injection, we could do another by mouth medication. Same medication, it would just be you're taking it by mouth instead of injecting. And what that's supposed to do, it's supposed to lower your A1C level, like your accumulated blood sugar. It's supposed to lower it by 1 to 2%. And that's exactly we would want you to be at least 1% lower, if not more. So
Well,
how does that kind of sound?
what does this gliptin do? I'm taking that too for the diabetes.
Say that one more time, I'm sorry.
I'm also taking sitagliptin.
Yeah, so that one actually is not as beneficial as the semaglutide. So that one is the one that I would discontinue. So I would discontinue that one. We would still keep you on the metformin that you're currently taking. And instead of the sitagliptin, we will be adding a semaglutide. That one should lower your blood sugar, and it could also help you with weight loss. So I know that
Oh, really?
yes, so what it could do, it could reduce your weight. So we'd be tackling two things at once. You'd be tackling your weight, and we would be tackling your blood sugar.
Well, anything that will tackle my weight would be excellent, because I was interested in, dealing with my osteoarthritis. My left knee been giving me a lot of pain. And
Yep,
they said that I needed to lose 25 pounds before I can have anything done,
yep.
because
So
they
study.
suggested surgery.
Yeah, okay. So studies have shown that this would do, it would reduce weight by, I think they said 10 kilos per year from what they've seen patients. So it could do that. It could treat your sugar, like we said. And as well for weight loss, it's not just, we don't just want to count on just this medication. I did want to talk about that with you a little bit too, but I just want to make sure that I addressed your diabetes first. So how do we feel about this medication?
Well, if you suggesting it's gonna make me lose weight and control the diabetes, I'm not against it. However, I don't know what 10 kilos is. So how many pounds would that reference?
That would be, let me just double check before I give you an actual number. 22 pounds.
Oh, well,
Yeah.
yes.
So it would be, we're looking at around 22 pounds. Now, I'm not going to guarantee you a full 22 pounds because everybody is different and every patient that we've worked with is different. But according to what we see in studies to kind of put drugs out on the market, it has shown up to 22 pounds.
Okay, but I need to lose 25 pounds to have the surgery on my knee.
So
So we
Courtney, I
also,
hear you. Oh, I'm
go ahead.
sorry, Lillian. I didn't mean to cut you off.
No, that's okay. Go ahead.
Courtney, I hear you saying that weight is one of the bigger concerns that you have for yourself, and that's something that you'd maybe like to talk about a little bit further today.
Yeah, we can, yes.
Okay. Well, I think we have some various ideas for you. You say you need to lose 25 pounds in order to get your knee surgery because you're having some osteoarthritis, and that's probably causing you some pain, right?
Yes, ma'am. And I've been on that naproxen, and I got to tell you, I used to only take it 2 or 3 times a month. Now I'm taking it, much more frequent.
For sure. Yeah.
Can
And
I
that's
jump in and discuss that before we talk about some things we could do? If I have this correct, you're taking naproxen 220 milligrams by mouth as needed, and you're doing it 2 to twice daily per month.
But I used to do it per month, but now the pain is a little greater, so I've been taking it more frequently.
Okay, and then you're also using acetaminophen 500. I'm sorry, what did you say?
Yes, I take the acetaminophen
How often are you taking that?
at least more than once a day.
Okay.
I used to take it as needed, and now I need it more frequently.
Okay. So you're taking that as needed, but are you taking it as often as you're taking your naproxen, or are you substituting the naproxen for the acetaminophen?
No, ma'am, I've been taking both of them. See, I was prescribed a naproxen, and now I'm on, I've added the acetaminophen. Now I do go to the pharmacy, and sometimes I might just get the Tylenol, whichever one is cheapest for me.
Mhm.
But again, because of the pain, I'm doing increased amounts of pain medicine.
Yes. My concern with taking that much naproxen is it's not the best for your kidneys. So I would suggest using Tylenol or something over the counter more often than using the naproxen,
Okay.
just for your kidneys. And then I would also suggest maybe we could, because we're going to be adding the semaglutide to your regimen, that would help with your weight loss. And when you're decreasing your weight, it would help with the knee pain.
Okay.
And then hopefully when I'm done speaking, we could come up with a couple exercise regimes that will help you further that weight loss. So then instead of that 22 pounds, we could get you to the 25, and then we could sign you up for that surgery you're talking about.
Girl, now I will say this. I put myself on a diet. I tried it about 6 months ago. I called myself was going to do the vegetables, took the red meat out. But honey, that's costly. And for me to be exercising, I'm sitting down more than I'm getting up trying to do anything. I don't even read. One of my favorite things to do was read books. I don't do that no more. I don't read. I don't do the crossword puzzles. I just, since the COVID, I just sit here.
So Courtney, and actually everything that you're bringing up is also things that we as a team kind of talked about as well that we would like to bring up with you. So it sounds like, well, first of all, let's talk about exercise. You say you're kind of sitting more than you used to, and you're not really enjoying things quite as much. And I understand that exercise at home is kind of a challenge for you.
Very much so. And who can afford to get involved with a gym? That's just too costly. If I can't afford to eat right, how am I going to be able to afford to go to the gym?
Well, I have a thought, Courtney. There are some facilities in the area that actually work on a scholarship, which means they're income based, and you may qualify to be able to go to one of those for low or no cost to you at all. And they have various programs, such as the YMCA. They have classes that are included with their membership. Very low impact, so very nice for somebody who has arthritis and pain in their knee. And also, it helps you to get out and socialize a little bit and make new friends and those kinds of things. So how would you feel if we looked at maybe applying for one of those programs?
Well, I'm willing to apply.
And that way, you'd be able to exercise a little bit more and maybe pick up some new interests or take up some old interests as well. And that also is going to help with the weight loss, which is also going to help with your pain.
Okay.
Also, I just want to add one thing about for your weight loss besides like we talked about the medications. I know that you are married, and what you guys could do, I know, like you said, gym memberships could be costly if you can't afford to eat healthy. How are you going to afford a gym membership? And I completely hear that, and I completely understand. But what is one thing that we can do, and I can kind of bring up to you is, even just going for like a little walk, like just getting out for try to at least for 30 minutes. I mean, we can start, let's say 10, 20 minutes a day, going for a walk 5 days a week, go out with your husband, even if you need to just go out to the grocery store, if it's too cold out, just walk around the grocery store. No need to buy anything, just look around, spend that, it will give you some time to spend with your husband. And then it'll kind of get your steps in, get your exercise in, and then eventually, when you're more comfortable, we can work your way up to 30 minutes a day, 5 times a week, which will get you hopefully, losing weight. Your heart health would be great, which will kind of work on your blood pressure, which will also work on your hyperlipidemia, which is kind of like the increased bad fat in the body. So all of that, like walking can do a lot for our bodies. So like I've mentioned before, it can kind of help tackle all of um, the disease states that we kind of have to deal with sometimes.
Well, I'm not against walking. However, my comfort level going into a grocery store and just walking around not buying in it. Now, come on, look at me. I would be very uncomfortable.
I get it.
I
I
might
completely
even be
understand that.
addressed in the
Yeah.
grocery store.
Yeah,
So
so many.
Courtney, I'm hearing you say that being able to obtain some of the foods that you need to be eating is a challenge for you.
It is.
Okay. So right now, is budget your biggest barrier between you and the foods that you want to be eating?
It's a barrier between the healthy foods that I
Okay.
want to be eating.
Are you connected with any food benefits such as SNAP or food banks or anything like that?
No, ma'am.
So what I would like to do for you today, Courtney, is if we could maybe work on applying for SNAP benefits, which is money that helps you buy food, and that can be anything. So you would be able to use that if you qualify to buy those healthy foods that you need and that would benefit you.
Okay. I would like that.
Okay. And has anybody talked to you about maybe consulting with a dietitian or somebody that can help you with some recipes that would be good for your diabetes and to make sure that your blood sugar stays in check and those kinds of things? Do you have like foods that you like to make, or would you like some help learning about some new recipes and some nutrition?
I'm willing to learn about anything that's going to help me control my diabetes.
Okay, yeah, and I think just making sure that we're eating the right things and gathering new ideas from somebody like a dietitian, that could be another connection that we make for you today.
Okay.
All right, I just want to consult with my team real quick. Does anybody have anything else to add to that matter? All right. Um, so Courtney, I want to hone in on, it sounds like you have some increased stress in your life with everything that's going on. You've mentioned that you've been to the clinic and people aren't communicating very well with you medically. And it sounds like there's some stress at home and your husband has some stress as well.
I guess you could say that, yes.
Okay.
We've
And
have a couple of challenges.
okay, what would you say is your biggest challenge, the thing that's most important to you right now?
The most important thing is getting the uh the high blood pressure under control, so that I can move forward with my mouth, as well as getting the weight down so that I can get the surgery on my knee, because I understand replacement knees can work for you. Got
Absolutely.
5 minutes left.
And that's one of the things why we bring up stress as well. Just because when we bring down our stress levels, we can bring down our blood pressure as well. And when we bring down our blood pressure, we're benefiting ourselves in all sorts of other ways. Or have you been connected with a therapist, or would you be interested in being connected with one? We have like community mental health programs and those kinds
Oh,
of things.
honey, because I don't feel like I have no mental problems. No, ma'am. Thank you.
Okay, I apologize for the use of word. So when we say mental health, we are just talking about things like stress, things like lack of interest in things, and to talk to a therapist that they have would kind of help us to work out through some of those things. But if that's something you're interested in, we can get you connected with it. And if it's not, that's okay too. We're really just here to serve you and to make sure that you meet the goals that you'd like to meet in life.
Okay, well, I'll consider it and get back with you on the mental thing.
Okay. Well, Courtney, thank you so much for meeting with us today. We really appreciate it. And I know that we've enjoyed getting to know you a little bit better, and we hope that some of our recommendations for you are beneficial. And if there's anything more that we can do for you, please don't hesitate to let us know.
Okay. So you'll be sending me some letters with the recommendations you suggested? Because how, I went to the clinic and this follow-up visit is 2 months later. And this is the first time that I got any action in reference to the first visit.
We
2 months.
certainly will. And I'm so sorry that you even had to wait, Courtney. That's not fair to you. And we'll be sure to compile our list of recommendations and get that to you right away.
Okay, well, thank you so much for seeing me today on this. This is new for me. I'm 63, so don't know. I don't even really know that much about the computer, but I figured it out today.
That's okay, Courtney. I have troubles with the computer sometimes, but we're just so glad that you can meet with us, and we're glad to get to know you a little bit better.
Okay, thank you.
Thank you, Courtney.
Thank you, Courtney.
Thank you.
Bye-bye.
Is this meeting gonna end, or do you think it'll?
So we have the 30
think we do
minutes
the-
post debriefing after the meeting with the clients, where we can just kind of make sure that we have all of our notes square and make sure that we've jotted down all the recommendations that we discussed and that sort of thing. And I know that we've got this running agenda going if we want to just maybe all kind of glance over that together.
Yeah, and I've also included the care plan. I tried to paste it as best as to my ability. So it's all in this document, as well as the reflection. So if everyone, and I tried to read what everyone wrote and try to copy and paste it, like it's all saying the same thing over and over again. So if everyone wants to just add their part and change their recommendations based on what she said, I know like for diabetes, you had mentioned the injections that she doesn't want to do. So
Yeah.
kind of changing that later down the line. And then yeah, so just kind of including your parts.
Yeah.
So it's easier on Lillian to submit it later.
Yeah, I mean, I think for the only thing that I'm just questioning is the interprofessional team collaboration. We have to like talk about what each one of us like discussed. Like, you know how it says like nursing, we will begin visit by introducing blah 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 blah.
Oh, I just kept it very general.
So just keep like, so should we each, we're gonna each put
Yeah,
one.
each just right. I did for medical student, I just said we will begin by introducing yourselves and other disciplines and then summarize concerns, discussing with the patients, which actually social work really you did
Yeah.
a lot of that with your script. So thank you for that. And then throughout each concern kind of give appropriate medication recommendations and go for the patients. I think that's like general what we do. And if you guys feel the need to edit that or want me to change anything, I'm fine with doing that. And Lily, feel free to edit as well if you disagree with anything.
Okay.
So everything looks good. Do you guys want me to make like a WhatsApp chat just to kind of make sure that before I submit it, like everyone kind of has a glance over it? And like at least just like be like, okay, are we ready to submit so I can submit it? Or what do you guys want? How do you guys want to do it?
I think
I
a
feel like we could
WhatsApp would be
just
good.
Sure.
I was gonna say we could just stay on the chat.
Oh, and just finish it up now?
Yeah,
Oh, that's fine. We can do
unless
that.
someone has something to do.
No, we can do it now.
I'm
I
good.
don't mind.
Get it out of the way.
Because I feel like it's not going to take long. All you have to do is like submit, like maybe copy and paste it into separate Word documents for the submission. Like I have the agenda separated from the care plan. So I think the agenda goes all in on one page and then the care plan goes all on one page.
Let me make a what's it called? Oh, actually. Okay.
And then the only thing I'm going to do right now is I'm going to edit each person's part in the agenda to make it more not look like everyone just copied and pasted their own thing and it looks, you know.
Yeah.
And maybe if you want to include your name at the, I don't think it, I think we could just put our names at the top with our team number, just so they really know who's getting graded.
Yeah, I'll do it right now.
Okay, perfect. And so then I'm just going to make everything bullet points so it's clear.
Did you say you want our names too, or just put Team 36?
I'd say put all of our names.
All right.
I don't know if you guys have the same issues with Wayne, but they're kind of like all over the place sometimes.
Let me just make sure I'm spelling everyone's name right, unless you guys want to write them down. I'll do them.
We could write them down, no worries.
Yeah, we'll just have you guys write them down because I don't want to misspell anything. Okay. So all that we're missing for the one that says interprofessional teams concerns and recommendation, we're just missing the periodontitis, what the recommendation is. So we'll just have to add,
Sorry.
and then I'll do this.
Where am I adding this on the doc right now? Let's see.
Below the listing into the table.
Right where I'm currently at, the patient concerns and recommendations.
I'm sorry, I'm doing something else, so I don't know.
Sure.
No, it's under the interprofessional teams concerns and recommendations. There's a chart.
Oh,
then,
I see.
Yep,
Perfect.
and then you're number 3. Oh, it's all the one assignment, so we can just submit the entire doc by itself, like all of it. We don't have to like separate like the agenda versus the patient care template. Like it's all just
Oh, we
one
don't?
submission. No, it's all just one submission, but
Okay.
it's fine that we identified the difference.
I think that's great. Okay.
Makes it a lot easier then.
I think all that's left then is the bottom half then of the care plan.
For the social and emotional stress.
Yes. Which and the healthcare disparities.
Let's see, healthcare disparities are defined as differences in the An example on how to complete this section has been provided. Okay. I mean, I would say the only thing that she's mentioned was the dental because she feels like she doesn't have insurance to do the extraction, right?
I would
Yeah.
also include her what is it called? She was talking about pricing for food, and I would probably include that too, like food insecurity.
Mm-hmm. Yeah, I think the best option for the dental was the free dental clinic, for Courtney specifically, possibly finding her something like that.
Okay, yeah.
Yeah, if you want to include that part.
Yeah. Yes.
And then I'll include food insecurity.
Perfect.
Anything
And then
else?
obviously we could add to each other's parts too.
Factors contributing.
Would you guys say was a challenge? Because I'm doing the reflection right now. So, what would you guys say was a challenge of working as a team? I can't come up with anything.
I really think the biggest challenge is just the format that we're doing this, which is through Zoom or Microsoft Teams, and sometimes we have computer glitches, and that can be hard to communicate with, and it's a little different than face-to-face.
I can do that. Yeah.
Look at the template. Mhm.
And I said for the advantages, like we all had a lot of ideas and we all came together and kind of discussed our concern and we all agreed to something.
Yeah, and we all
Yes.
discussed our not only our concerns but our recommendations.
Okay. Find how the team optimize their ability to function during the visit. I don't freaking know.
I
I'm
think
sorry, what'd you say?
earlier on, being able to delegate topics and also having a facilitator to kind of move things along to keep it within time frame was a way that we did that.
Okay. I said being able to delegate topics of discussion / concerns and having a facilitator to keep us on time and on track.
That sounds good. So does anybody know why the visit was reduced to 30 minutes? On the Canvas page, the visit should have been 45 minutes. Did I miss a memo or anything that?
I don't know. The Saturday group said that the same thing happened.
Okay.
Yeah.
Maybe they got it mixed up, like with the scheduling. Maybe they did 45 post, 30 visit.
But yeah, I think time was definitely our biggest restriction.
Let's see. Okay, identify and explain a minimum of 2 lessons your team learned about collaboration or ability to function as a team.
I think one thing is just the kind of, this is going to be very poor English, the newness of working with people of different disciplines for me, because, for instance, you all offer a perspective that I half the time didn't know what you were talking about. I have a very limited medical knowledge. I have no dental knowledge whatsoever, and even less pharmacy knowledge. So sometimes I would be listening to you guys talk and I'm like,
Like a whole other language.
okay.
Yeah.
But just in, the other way, you're able to have skills that we may not necessarily
Yeah.
have, like, being able to find resources for patients, maybe in more creative ways than we might know at the moment. And really being able to kind of bring it all together. So that was really helpful.
Yeah, a lot actually. So thank
Yeah.
you for that.
Mm-hmm.
That's very true.
I think that was really eye-opening too. I don't really realize what I don't know until I get around people who know things that I don't know.
No, yeah. No, the way you facilitate things and kind of tie things together, like I would never be able to do that. I'd be like, oh,
It was very
wait,
helpful.
no, this. So yeah, it did help out a lot. But can you word that on the thing? Because I don't know how to like English. Like how to, what's it called? Like how to say that without sounding like a broken record.
So one more time, what was your thought? And I'll see what I can put in here.
Like how you said, like just kind of like we kind of have different ways of like knowing things, but then we come together and like it kind of just like builds on each other.
Oof, that's hard.
Yeah. Like,
Is everyone satisfied with the healthcare disparities section?
I'm
Or
looking
do
at
you
it.
think that we should add something?
I'm reading it. Insurance looks good. Food looks good. Dental looks good, and I think he's still adding a little bit more. No, I think it looks good.
A reflection looks good. I just glanced at it too. So then just the care plan table.
I think we're just missing the I can't even say it. The periodontitis, just the goal. So like what is the goal that you're trying to achieve? I think that. And then just for Diana, if you just want to kind of make like a little what you discussed with the patient under the social and emotional concerns, like the stress. I know you talked about that a little bit.
You also talked a lot about more than that. Like if you want to add that, like you talked
Yeah.
about resources you could do for diet and exercise.
I'm just trying to think. At the risk of being redundant with what I had put under and professional team collaboration, I'm trying to think of how I want to say that.
I would just copy and
reflection.
paste.
That works for me.
This whole thing is redundant. If you guys didn't know this, our agenda and the care plan are the same thing.
Yeah, I'm 100% used to redundancy. I have one professor who can be very redundant, so I'm used to trying to reword myself over and over again.
There's no need. I think we'll be okay. And then other than that, I think everything looks good.
All right, just added those goals. Yep.
Can you just make sure your names are spelled correctly, or did everyone write their own name?
I think I wrote my own. Everyone else ended up writing their own name, yeah.
Okay, if we're all good, then let me just delete this one. Mine. I think it's good to submit.
Yeah, I think.
I'm just finishing up my section really quick.
We're satisfied with the reflection, right? Yeah. And Lillian, I'm gonna assume that no news from you is good news and that it's submitted properly. You don't have to worry about it.
Yeah, I'm just gonna wait up on Diana, or if you guys want to log off and just, if you want to wait, I don't know. I'm if I don't email you, then I think everything's fine, and I think it should show on your canvas that you don't have anything due, that it's submitted.
Sounds good, and thank you for submitting for us.
Thank you for doing that.
No problem. Yeah, Diana, when you're done, if you want, I'll just give you a little bit of time to do it, because I do have to head over to class. I have ID today, infectious disease. So if you want to work on that, take your time. I'll check back in and like as soon as I get there and see if you're done, and then I'll submit it.
Yeah, I'm actually just wrapping up now, so by the time you check back in, I should be done.
Okay, sounds good. And I'll submit it. And if you don't hear back from me, then it was submitted.
All right.
Perfect. Thanks,
Alright.
Thanks,
guys.
everybody.
Thank you guys. Bye-bye.